Hello and welcome, everyone. I'm Sharifa Dickinson, the Director of Strategy and Engagement for AMCAS at the AAMC. We're going to wait about 30 more seconds to allow some more of our students to come on in. And while we wait, we're so glad that you could join us today for today's webinar on reapplying to medical school. Whether this is your second time around or you're exploring new strategies, we're here to support you every step of the way. We have two fantastic panelists with us today who will share valuable guidance on your reapplication strategy. We have Brittany Moorhack, Associate Director of Pre-Health Advising at Duke University, and Tom McKenzie, Assistant Director in the Office of Admissions at Case Western Reserve University School of Medicine. And now, I will pass it over to Tom.
Well, thank you so much, Reapplying, and thank you so much, Brittany, and thank you so much, everyone, for being here today. This is a topic I think that has sparked a lot of interest from both Brittany and myself recently. So if you're on this call today and you're thinking of reapplying to medical school, perhaps applying for the second time or more, you are not alone. The medical school applications process has grown a lot more selective. So thinking about my conversations I've had with students and Brittany thinking about her conversations that she's had with her students, we thought, what if we combined and collaborated and shared about when, how, and where to reapply to medical school from both an admissions and an advising perspective. So we hope you get a chance to gain some valuable information from both of us, experts on both sides of the aisle, and you can walk away with some takeaways on how to proceed with your next application to medical school and what that might look like. So I will turn it back over to my colleague, Brittany. So we'll kind of do a little bit more of a more formal introduction next.
Hi, everyone. Thank you so much for joining us. I'm Brittany Moorhack. I'm the Associate Director of Health Professions Advising at Duke University. I've been at Duke 7 years actually this week, and I've been doing pre-health advising for 10 years. As Tom mentioned earlier, we have had some fabulous conversations over the last few years about supporting reapps, and just felt like we wanted to have an opportunity to talk with you from both sides of the table, from the advisor and the admission side, so that you hear the different perspectives of what we think are helpful for students who are thinking about reapplying to medical school.
Yeah, absolutely. And like I said, I'm the Assistant Director of Admission, and I've been at Case Western for 6 years. So I interview students, I review applications for admission. I have read many of Brittany Moorhack's recommendation letters from Duke over the years too. So this is really an ideal scenario to have us both here at the table to collaborate, talk, and hopefully you can come away with some good, valuable information. So before we dive into it, let's talk about some goals. Let's talk about what we can kind of maybe take away. And as I mentioned, it's becoming a lot more selective and a lot harder to get into medical school. And we hope that you can kind of determine where are some gaps where your application may be coming up short, some takeaways. Okay, here's one additional thing I can do. Here's 2 or 3 additional things I can do to help maybe fill in some of those gaps. I also just want to reiterate and share something really important. And I think to think about it like this, there are plenty of times where Brittany and I have had conversations with reapplicants, had conversations with students. And there are oftentimes, perhaps more often than not, where the answer as, why didn't I get into medical school the first time, is not always clear, cut, and dry. It's not maybe the type of scenario where you're thinking, okay, I do these 3 things and then I get into medical school and I can secure an acceptance. I do these 2 things and then I can secure an acceptance to medical school. Brittany and I are not going to be here with all of the answers. We are not going to have those 4 things that maybe you can have on your application that will essentially be your ticket to an acceptance guarantee, right? There's a lot of different factors that come into play. And the moral of the story in talking about all this is there are multiple ways to get across the bridge to achieving your goal of an acceptance. Every admissions office is different. Every admissions professional and pre-health advisors have different, perhaps lenses they're looking through, perhaps have different approaches to their application process. And it's not like one is right or wrong. It's about really securing and arming yourself with the information where you can put a better foot forward and you come away with a lot more knowledge and takeaways so you are more prepared for the application cycle the next time you apply. We also want to reiterate, and we're going to talk more about this in a little bit here, but when you choose to reapply is important. Yes. So you apply to med school unsuccessfully. When and the time you choose to apply is important, but it's not always the deciding factor. So I'll reiterate that again. It's important, but not always the deciding factor. There's many factors that make up that admissions decision, and perhaps are going to let the pieces fall where they may. But when you reapply is just one piece of that. So hopefully give you some context, right, and some approaches as we continue with our talk. Now, I'm going to dive in and talk about just some basic insight from an admissions perspective. So we see a reapplicant. I review hundreds and hundreds of applications every year. When we see a reapplicant, what happens? And then we'll let Brittany dive into her piece from the advising perspective. So what has changed from your previous application? Our admissions committee at the School of Medicine at Case Western, and again, I'm really only speaking about Case Western for the most part here, so please keep that in mind. Every admissions office is different. A lot of the different, I would say, approaches are the same, but there's going to be a few differences as well. But I think one thing that you're going to find pretty consistent is with all reapplicants and admissions offices looking for what has changed from your previous application. So hopefully you can identify a handful of things that have changed from the last time you applied. Did I retake the MCAT? Perhaps, maybe not, but that's all right if you did or didn't. Depends on your score and the type of reapplicant maybe you are as well. A lot of factors there. Did you pursue a post-bac or a special master's program? Most of the decision is going to be academics, not all. It's probably at least half the decision oftentimes. Can you handle the academic rigor of med school? So those are probably two of the biggest changes you might see, or we might see in a reapplication, is updated GPA. Maybe I pursued a post-bac or a master's, or I retook the MCAT. Also, experiences wise, what additional experiences, whether it's patient care exposure, whether it's any kind of volunteering or community service, whether it's work experience, what has changed from my previous application? Essays, different approaches to my essay questions, anything along those lines. I also, small tidbit, but I think details count, maybe not a make or break thing, but I would update your letters of recommendation. This is something a little bit smaller, but something that I think is very, very important as well. So even if you just have your recommender update the date from the previous year, if you're applying perhaps very soon after your first application, I think it just helps to know your recommenders have spoken to you regarding this application. They've continued that rapport with you, and they have an updated year on their letters of recommendation. Can certainly submit new letters of recommendation as well, but make sure they're at least new letters or they're updated. Next one, I put this in bold, apply early. We review applications on a rolling basis at Case Western. It's on a first come, first served basis. You have to apply early. Submit AMCAS in the month of June or late May if possible, but I think June is a very appropriate. Secondary applications, July or August. If you get into September, October, it's going to be a little bit tougher. Can't guarantee we'll have interview spots available at Case Western. The sooner you apply, the sooner they're going to get to your application. I think applying early is very critical. So that's one other piece that if you didn't do the first time, can definitely apply this time around in terms of the early application. I always like to say, reflect on what you've learned from the previous application cycle. This is not necessarily something that is a requirement by any means, or is it something you would have to do? But I think it's important to, if you have the opportunity, ideally in one of the secondary essays, sort of give a nod to your previous application and move on. Talk about maybe one or two things you've done since your previous application. Talk about what you learned from your previous application. It doesn't have to be a long, drawn-out essay in one of the secondary responses. I think a few sentences is just fine. I also think this can be a game changer, expressing an interest or a connection with the schools in which you are applying to. And this is really important because if you think about at Case Western, at so many different medical schools, there are way more applications than number of spots available. And I find our admissions committee is not only reviewing for academics and qualifications and fit, but they're also interviewing and assessing for, wow, if we offer an interview to this student and acceptance, what are the odds they're going to matriculate? So if we see a student that applies from Southern California, all their experiences are in Southern California. I'm throwing out a complete hypothetical example here. What are the odds they're going to come to Cleveland? Well, I think it is always helpful at Case Western, for example, we have an optional essay. Tell us anything you would like the admissions committee to know about you. A lot of students don't fill it out, but some students will fill it out and write an essay on why Case, why Cleveland, a connection. I've even had students mention me by name in the application. Like, it's wow, they came to this particular webinar. You're on one now, right? So any kind of rapport or connection you can establish with an admissions office at a pre-health fair, researching the website, I think that can go a really long way. Wow, this individual took the time to write a really nice, thoughtful essay about our school, and I feel pretty good about them coming to our medical school if they've really established a connection and clearly did their homework. Okay, so reevaluating your school list, I think that's always critical from year to year. We'll definitely get into more about that too, but I would not apply to the same exact schools. You definitely want to at least tweak that approach. I also would share, consider applying to both MD and DO. That is becoming very common to apply to one and the other instead of one or the other. So I would always say, keep an open mind on that. I would say apply both MD and DO. You want to cast that wide net to give yourself the best possible odds of being admitted. And the last thing is listen to the admissions offices. At Case Western, we love letters of interest, letters of intent, post-interview especially. Admissions is it's a long cycle. You got your application, you got your interview. Every communication point and data point in between there is critical as well. Many schools will say, yeah, we love letters of interest, letters of intent. Some schools might not accept letters of interest or letters of intent, but listen to that school. For example, if a school says, don't contact us, we don't accept letters of interest or letters of intent after your interview, I wouldn't do it. I would listen to the school. We at Case Western, we love when students keep in touch with us. We love when we see letters of interest, follow-up letters of intent, whatever they're comfortable sending. It really helps to know who remains interested in us. So those are some things from an admissions standpoint and perspective that can hopefully provide a little bit more context. All right. I also will share, this is really good information from admissions and also advising. All right. So now we're going to kind of dive into the pre-health advisor realm of things, and I'll turn it over to my colleague, Brittany.
Thank you so much. So I also want to start by sharing that I am going to be speaking as a pre-health advisor, but I am most likely not your pre-health advisor. But I know many of the pre-health advisors who work across the country, and they're wonderful professionals who want to work alongside you. So I'm going to talk about the best practices we use at Duke, but we'll make a shameless plug that you should be working with your office and your team when you have them, because they might have insight into your institutional pathway that's a little bit different than mine. So when I work with students who aren't successful in their first cycle, I break it down to 3 different sort of categories that we're looking at that help somebody be successful. The first is, what have you done? What are the things that you've done inside the classroom, inside the testing room for things like MCAT and Casper and Preview? And what have you done outside the classroom? What are the experiences that you've engaged with to grow as a future physician, but also grow as a person? That kind of leads into the next part, which is, once you've done what you need to do to be successful, is how are you communicating that to medical schools? As Tom just mentioned, the process keeps getting more competitive, and how you talk with schools through your primary and your secondary applications helps them understand how those experiences have shaped you. What lenses have they created? What skills or core competencies are you picking up, learning, stretching, and growing? All of those things are important in helping medical schools understand where you've been, where you are now, and how you got to that moment, and where you want to go next within medicine. So these things, it's not just what you do, it's how you convey that to schools. And then the last piece is applying with best practices. And so those are some of the things that Tom has already referenced, and we'll break those down. But that's sort of what I like to tell my students is, quote unquote, playing the game, right? Applying on time, making sure we have the things we need so that when someone like Tom on the other side gets your application, you're ready for review. These are the three things we have mostly within our control as an applicant and a pre-health advisor. But there's also these factors sort of floating around outside a cycle that may be impacting you as a candidate or a reapplicant. The first is the cycle pool. One thing that Tom and I know from watching cycles year in and year out is some are larger, some are smaller, some will feel more competitive in terms of what that looks like, and we don't have any control over that. The next is state residency. So Tom is talking from a private school perspective, but as somebody who advises students on the other side, where a student holds state residency as an applicant might impact how they're feeling about their cycle. Do they have a lot of state schools? Do they only have one state school? Are those state schools good matches for you? Because you will be most likely the most competitive at a state institution where you have state residency. And then the last part is your network. Have you built relationships with people in admissions like Tom? Do you know folks who work at these institutions? Have you spent time at these institutions on the medical side and the educational side that might give you some insight into helping to tell your story to individual schools differently? All of these things come together to help someone be successful or not. And as Tom said earlier, sometimes we have students who are scratching our heads a little bit about why maybe they weren't successful. Sometimes it's one of these sort of factors outside of our control. And so what we want to focus on is understanding the things we can control and the things we can't control. Next slide, please. So if you are coming off of a cycle where you were not successful, we kind of want to start by debriefing each of these sections. So looking at the different components of your application, what did you do? Are your metrics in the ranges where you feel comfortable? If not, do you need to go retake an MCAT? Do you need to go do some post-bac work, something to change your metric profile? I will say the second part is what I've heard more and more frequently from candidates after they talk with folks in admissions is, oh, they weren't really sure why I wanted to be a physician. And sometimes students get mixed feedback about, well, you don't need more shadowing or you don't need more of this. But as an advisor on the other side of the table, when that feedback gets, I'm not sure why this candidate wanted to be a physician, to me, that means you need more time shadowing physicians and more time working with patients, because a person's personal story of motivation and confirmation, the confirmation piece has to stem from understanding the role of a physician and understanding how your skills are already developing working with patients. So do you have enough time in those settings to be able to highlight to schools that you know this is the right fit for you and that you're already practicing those skills? The next is research and community engagement. And I sort of have those paired at the bottom because schools can have different foci on those. So some schools might be a little bit more research centered, some might be a little bit more community engagement centered. Here at Duke, we encourage our students to have experiences in all these different dimensions, but the depth within each might be different. And that's where you want to think about matching your school list. You don't want to apply to a research-focused medical school if research isn't really the thing of interest for you and you don't have a lot of experience in it. And then the same goes for if you don't have a ton of community engagement and you're applying to community-focused medical schools. So the first is, like, do you have all those experiences to help bring it together? If you feel like, yes, those things are fine and I still wasn't successful, the next thing we look at is your narrative. How are you telling schools that you're ready for this? The biggest mistake I see are people using their 15 experiences to describe what they did and not add reflection of how they've learned, grown, impacted other people, or had other people impact them. These experience entries really should be centered on those aspects. It's not just telling a school that you did a thing, it's telling them what you learned from those things. The second piece I see a missed opportunity is when people don't use the other impactful experience section of their application when they really should. So coming before your time in college, do you have different challenges or obstacles, or did you grow up in environments that maybe you didn't have access to healthcare, education, or different socioeconomic statuses? Medical schools want the context in which you grew up, and this can be a place where you can highlight for schools different core competencies you've learned and grown along the way. The third part I see is when somebody has an institutional action or something legal to report and they don't focus on any growth. They just tell a medical school what happened, or maybe they don't take any accountability. We send people to medical school all the time with institutional actions, but the people who are most successful are the ones who tell schools how they grew from that experience. I think we can all agree we don't expect that you're going to be in medicine and not make mistakes along the way. That is part of the learning curve, but it's really the learning part that's important. And like I said earlier, that lack of clarity around why physician, you have to be able to tell a school that you know the physician role is right for you, not that you're sure that a helping profession is okay, right for you, or that a career in healthcare, really understanding that physician role. Sometimes that is just, maybe you're doing it great verbally, but your writing wasn't conveying that. Sometimes that's a signal you need some more experience. So if those things are still feeling okay, we look at the last part, which is the application best practices. As Tom indicated earlier, you might be late. So are you applying on time? We recommend within the first couple of days of submission of it opening, because we are an institution that provides support through a letter, and our process has some of those timelines with it. So does your school have a committee letter or like a letter packet that you might need to be following benchmarks for those as well? If so, you want to be working with your school so you're making sure you're on time for the application process and their process. You want to submit your secondaries on time as well, in a timely fashion. And you want to make sure all of the tests that you need to take are done and that scores are available. So that's the MCAT, Casper, and Preview. And then making sure your letters of recommendation have been uploaded in a timely fashion as well, so that when everything is there and ready, your secondaries and everything of that nature, that Tom also has the letters he needs to take a look at. If those things are still feeling okay, sometimes it can be a school list. It can be a mismatch in goals. So maybe that is you're really research focused and you applied to a lot of community focused medical schools. Sometimes it can be metric ranges. A huge shout out to AAMC for having the MSAR, the Medical School Admissions Requirement Database, which is incredibly helpful for finding where your metrics fall within the scope of a medical school for their last cycle. And are you applying to state schools that are not out-of-state friendly? So there are some schools that don't admit a lot of students from out of state or don't accept them at all, making sure you have those sort of tiny details all lined up. And then the last part is not customizing your secondaries. So maybe I know from this side of the table, you are writing a lot of essays during secondary season. It can be very appealing to take the idea of, I'm going to copy and paste a lot of this and send it to a lot of schools. And there might be content you can reuse and tweak a little bit, but you really want to make sure that an individual medical school is reading in their secondaries from you that why this school is a good fit for your goals, your values, and the experiences you've already had. Tom mentioned earlier, Case specifically wants to know you want to be in Cleveland at Case. So how are you conveying that through secondaries? And if you're not customizing your secondaries to school, it's unlikely schools are walking away with a feeling like you would come if they were to interview or admit you. One thing I will say as a whole is, in my experience working with students, it's very rare we look at these three categories and go, oh, we know the problem. It's this one thing. And if we fix this one thing, it's all going to be okay. It's usually a few things sort of piling up. And so I always encourage people, give yourself some space when it's been unsuccessful as a cycle, but then really dig in and have some hard conversations with yourself about what went really well so that we don't create new mistakes, but also what might need to change for the next time around. Next slide, please. So, reflection, what have you learned? One of the things that I find the most with reapps is that if you've been told no for something that is really important to you and has been a lifelong goal, my students, my advisees who reapply and are successful feel a lot more clarity about they are sure this is right for them. That is not a deficit. That is not a problem. That is not a stigma. There are lots of things you can learn from an extra year or two that help you convey a lot of those things to medical schools. So what have you learned that you'd like to do different? But also remember to take a few minutes to celebrate the things you did right. Please reach out to admissions offices. With you being here today, it means that you are already signed up for the AAMC virtual fair. I think tomorrow is a great time to start talking to schools. You're getting to hear from Tom with Case, but talking to lots of different schools, right? The number one thing I hear after my students go and talk to schools is they come back and they'll say something to me like, Miss Moorhack, did you know they all disagreed with each other? Your job is much harder than I realized. And we always laugh a little and say, yes, it is hard because schools are really different. So if you have a pre-health advisor, after having those conversations, go talk to someone. What are you hearing? I think one of the things I help a lot of reapps do is we talk through what are the common themes you're hearing from multiple schools, because that's something to pay attention to make sure is very much changed. what feedback are you getting that maybe feels different from school to school, right? Is it metric, which may be at a metric focused medical school or medical school with higher metrics? Yeah, that is feeling like a feedback, but all these other schools that you were interested in don't have that feedback. Maybe it's not an issue for them. Their priorities are different, their missions are different, and their values are different. So giving yourself some space to like understand this is going to probably be conflicting information, and then deciding what's important to you so you make the changes moving forward that make you more competitive for the schools that you're most interested in. Please, please, please don't reapply until you fix the issues. If you know what was keeping you out potentially, or you have a few things lined up, make sure you correct those before you reapply. You all know the cycle is long. It's more than a year. And so if you haven't changed something while you're in cycle, taking a cycle off to make those changes, have those experiences, and then reapplying is often a better choice for some people. Next, what is your school advising around timelines and process? Does your school have different feedback on when to apply? If you're in a post-bac program, sometimes that can have different guidelines for applying, because all of those things are tied into their experiences with that student population. Most of us that work in pre-health advising have relationships with schools where we're helping to set our timelines where we know it's still going to be helpful for you. So work closely with them. If your office is disagreeing with something I say, please listen to them, because they probably have information about your undergraduate institution that might be different than mine. Next, you really want to make sure you apply to a broad range of schools, just sort of in theory, but particularly as a reapplicant. Which schools are really good fits for your values, your experiences, and your goals, and your metrics? That is a piece of it, but it's not the whole piece of it. You really want to make sure that there's balance. You want to make sure that you're paying attention to which state schools accept applications. You'd be surprised how often I talk to people who apply to medical schools that don't even accept out-of-state applicants. So make sure you're spending your time, your money, and your effort in the ways that are going to help you be the most successful. And don't reapply with the identical school list, because likely there's something in there that could be shifted anyway. This is a great place if you did think about osteopathic medicine the first time. Some of my advisees will think about adding osteopathic. They'll look more broadly at what that looks like for educational pieces and sort of decide that maybe they want to add a few of those this go around. And then every admissions office communication is different with students. So some schools will give feedback. Some schools will not. And I know that can be hard. I know that can be frustrating. But one of the things I've seen post-pandemic that I think is a wonderful silver lining to that experience is that I find more admissions offices are running online webinars. They're having office hours where you can drop in and talk with people in admissions. And those are different ways that you can gain some insight into your preparation and your plan and how is that fitting with that particular school. But if a school says, please do not give us letters of interest, do not give us letters of intent, please don't reach out with updates, or we don't give any feedback, please take them at their face value. This is one place where you can highlight your professionalism and your ability to follow directions. So don't take what one institution says or one advisor says and apply it to every medical school in the country, because that is very likely to be inappropriate at another institution. All right, next slide, please. So when should you reapply? We just talked about what are the pieces that make you successful? How do you debrief after a cycle that doesn't go your way? But like, when do you do that can be really important. So the number one thing is, have you changed what you needed to change? And have you evaluated the time that you're going to need to make that change? So for example, if you feel like you don't have enough patient engagement or shadowing, and you haven't done that in your year of application, you need at least a year to do those things. And by default, that's going to push you out at least a cycle. Sometimes someone will discover that they need to do post-bac work, or they need to retake an MCAT. Those things take time and might be making some of those decisions for you. The second would be, what do your schools of interest say and do? Does your undergraduate institution's pre-health advising have any insight into whether there are certain schools of your interest that like to see people take a cycle off or not? Some schools have a preference. They like to see significant change from cycle to cycle, and that can be really hard with just one cycle in between. And so getting some of that feedback from the schools themselves and from your pre-health advisor. I would be remiss if I didn't mention that MCATs expire. And sometimes that is driving somebody's decision making because they are looking at the possibility of having to retake the MCAT. If your MCAT score isn't what exactly you hope it to be, sometimes that's okay. Let it expire, retake it, and hope to also increase your score. But I do recognize that there is privilege and time that needs to be set aside for retaking an MCAT, and sometimes that will drive someone to reapply because they know in the next cycle their MCAT will no longer be valid. I always take time to pause with my advisees who are reapplying to recognize this is a hard process. It is emotionally hard at times. It can feel really isolating. It can be draining. It takes a lot of time and money and effort. And sometimes people just need a cycle off to take care of themselves as a person, as a future physician. They might need to set some more money aside to reapply. They just might need the space from it to sort of process that they weren't successful the first time and then reapply with a year off just to kind of decompress. Because the way the timelines are set up, you would be overlapping cycles potentially, and that can just be really draining for people. So make sure you're reapplying not only when it's right for your candidacy, but when it's right for you as a person. Sometimes whether you're on a wait list or not will also help people make decisions. Folks who are sitting on a wait list or 2 wait lists, let's say coming this upcoming April, you may feel like you're not sure if you need to reapply. Some people like to consider the idea that if they get in, they don't have to start another reapplication. They feel better about that plan and they're just going to wait it out. And if they don't get off a wait list, they'll take a cycle off and reapply. Some people feel like I was on the wait list, which means I'm close enough. I'm just going to roll another cycle. I always encourage people to still do a full debrief, but recognizing you're going to be in 2 cycles for probably a couple months while you're navigating both of those. At the end of the day, there is no wrong or right answer of when you should reapply. That answer is going to be different for each of you. And you really need to think through the different facets of this for you as an individual and as a future physician of what makes sense for your candidacy and your life. Tom, are there things that you see on your side that would help people think through about the when?
I always, when I'm sharing and offering feedback to students that are looking to reapply, I always like to ask them, and I just ask, tell me how the application cycle went for you this year. Did you receive interviews? Like, where do things stand right now? And I kind of like let them kind of guide the conversation. And, if the conversation turns into, well, here's my MCAT score. My MCAT is significantly below the national average of a 512. Maybe I think about, well, probably want to reapply for the MCAT. And if I'm talking to you in the month of April, MCAS opens in a month, might be a little tight timing. We probably want to wait another year. I mean, that's just one example, but I think it's very much a case by case, much like you said, Brittany.
Right. All right, next slide. I think we are at the end of our time of us talking at you. But it was really important for Tom and I to leave some space for questions. So we are going to turn it over to our wonderful colleague at AAMC to bring together some of the questions we've been asked.
Thank you so much, Brittany. Thank you so much, Tom. You guys, I knew our panelists would have such valuable information. And in knowing that and knowing how much time I wanted to make sure that they had, I skipped right through the housekeeping portion for this session. Just a quick reminder, you guys, make sure that you're putting your questions in the Q&A box and not in the chat because we want to make sure that we can get to your questions. So we're going to go ahead and start now. You guys ready?
Mm-hmm.
All right. First question. This could go for both of you. If you've been out of undergraduate school for a longer period of time and have lost contact with former professors, do you recommend getting letters of evaluations from the supervisors that you're working with?
I can take that one to start. I would probably say that's a great individual that can write you a letter of recommendation. I think letters of recommendation are one piece to a large application. Yes, they're important. They're a big piece to the admissions process. And I think that med school admissions is somewhat of a brutal business. What have you done for me lately? We value strong upward grade trend, all of that. So I think a very recent recommendation from such as a place of employment is a pretty ideal, perhaps, letter to have on your application.
And then from my perspective, the first thing I tell advisees to do when they have this type of question is to check the schools they're looking at. Some schools tier their letter of recommendation or letter of evaluation requirements. So it'll say something like, if you are currently in school or you've graduated in the last 2 years, we look for X, Y, and Z. And then it'll say, if you've been out of school 2 to 3 years, we would prefer this. And then there's almost always a category for those tier that's like, if you've been out of school more than X amount of time, we are looking for these letters. So I think schools recognize across the country that those letters are going to sound different. Some schools may not waive that science letter writer or a faculty member as a whole. I always remind students, you are still applying to go to graduate education. There's this weird convergence of graduate education and a profession, but they might need to hear from someone who's taught you in the classroom. So I always encourage people to start with what the schools are asking for and see what that might need. I do think a supervisor always, as what might be a non-traditional candidate or someone who's taken more time out, somebody who's supervised your work is always someone I'm going to recommend that an advisee include.
We do require at least one letter from an individual who has seen the student in the classroom from one of the core science classes as well at Case Western.
Fantastic. Thank you for that. Here's a very interesting question, and it might be school dependent, but Tom, I think you might have a response for this one. Are you only supposed to send letters of intent or interest after interviews? Or can you send them after submitting your application?
You can certainly send them at any time you'd like. I think post-interview is probably a much more common standard of practice to do that. We at Case Western, unfortunately, don't accept any application updates unless a student is formally invited to interview. If you are invited for an interview, we can certainly take any updates, any letters of interest / intent. So I think it's probably much more common to see a letter of interest or intent after the interview, but there is nothing stopping a student from trying to submit it before that. I think a good way is to look on the school's website. If they don't accept any application updates or don't accept any application materials after submission before an interview, I probably wouldn't send one. And then after the interview day, perhaps you can reach out, or you can find out, excuse me, on the interview day, yeah, we take letters of interest / intent. Great, well, we're going to send one. But if not, then I wouldn't send one either. It just depends on what the admissions office says. Sorry, Brittany, what were you going to say?
And I'm just going to do a shameless plug for AAMC having added this information into MSAR this year. So you can actually, I always encourage people to check a website and MSAR, but there is some information there as well if you're thinking about letters of interest, intent, and update letters.
Thank you. This is a great question because we're always talking about we want to see an applicant's unique journey and experience. How do we stand out among thousands of applicants? A hard one, though.
Well, I think it's every school is different. And I one thing I will say is non-traditional is kind of the new traditional when applying to medical school these days. I feel like, I don't know about you, Brittany, but I always feel that way. And I think, how am I going to stand out? Well, I think everyone has a more unique story that is true to them. I don't think you should approach your application, I got to have big fancy words in my essays. I got to have big fancy experiences and use big fancy words in the descriptions. I wouldn't approach your application as, let me try to compete and sound better than these applicants. I would just focus on putting your best foot forward and sharing your lived experiences and sharing that story of why medicine and why now at this point in my life. And we talked about a lot of really great things in this talk. I think if you do that and you talk about really and take the advice of many things that both Brittany and I shared throughout this talk, I think you can put yourself in a very favorable position as you approach an application cycle. So I don't know if that helps answer your question. I hope it maybe provides context. I don't know if you'd want to add anything, Brittany. Go ahead.
From my perspective, my students who stand out in cycles are the ones who are authentic. They know themselves. They know how their experiences have helped them change and grow and find priorities within medicine. So whether that's a lived experience, your identity, or the experiences you've engaged with professional, when they put those experiences in context, help medical schools understand how this is all coming together, they are often by students who are least worried about what the internet tells them to do, or some sort of a logarithm or formula for getting into medical school. They're the ones who just know themselves and know their goals and put that together on paper and convey it to schools, and then choose the right schools that have shared values. Those are the ones that I see generating the most interest from medical schools, because they're making good matches and they're telling a story. And I hesitate to tell stories. Please don't tell them about the color of the room that you're sitting in. It's about your learning and growing. But those are the students that just really stand out because they're helping schools understand how they've gotten to this moment. And being yourself is really important in that.
Absolutely correct. How many hours of post-bac work do admissions officers want to see to make up for a lower undergraduate GPA? And do you prefer graduate work over graduate level work?
I would choose a post-bac or a master's, and I would choose, when you're choosing between a post-bac or a master's, I think it's appropriate to share what program is the best fit for you. I wouldn't say we have a preference between post-bac or master's. I think at least 1 year, 30 semester hours, roughly 45 quarter hours is going to be, I think, expected to show some consistent, I would say, like upward grade trend, consistent, strong academic performance over the course of 1 year. I think 1 year is good. Many students have 2 years, and that's great too. But I think 1 year is a good benchmark to aim for if you're looking to boost your GPA.
One thing I tell students to look at is whether they need to retake any courses, because that might indicate undergraduate versus graduate work. But I cannot emphasize enough of what Tom says. Find a place where you can fit and be successful, right? If the point of your post-bac is to show medical schools you can do this work, make sure it's somewhere that you can be successful. Think about what worked and didn't work in your undergraduate education and find a place where you're going to flourish and that you're going to be able to continue to show them that you can do this work.
Let's talk a little bit about secondaries. For secondaries, a lot of schools have deadlines much later than September. What is the norm around submitting closer to the deadline? And would you advise reapplicants to still submit a secondary later in the cycle?
I'm happy to start. We tell our advisees, like, be turning these around in 2 weeks. I know that sounds like a fast turnaround time, but what I will say around this is, particularly for reaps, you kind of have a sense of what questions you might be asked. So you can start preparing some of those thoughts earlier. The World Wide Web is a wonderful thing. The internet is great now. And sometimes you can find last year's questions. And by sometimes, I mean almost all the time, you can find last year's questions. And while that is not guaranteed to be questions next time around, it can give you some insight into what the schools you're applying to might be asking you, so you can get started on some of that ahead of time. I think being on time is the whole thing. It's your primary, it's your standardized test, and it's your secondaries. And so the later you submit that, the later you're going to be reviewed. And that might have different impacts at schools. Tom, your thoughts?
Yeah, I probably wouldn't go a whole lot later than August on the secondary applications. We do have a recommended 2-week turnaround. Now, we don't look at when you got the secondary and when you submitted in July and August. It's just a recommendation. But you get into September, especially in October, we don't have a ton of students that interview that submitted secondaries during that time. So I would advise AMCAS, June, maybe July, secondaries, July and August at the latest. I guess if you're in a position where you have a secondary application and it's September, it's up to you if you'd like to submit that application. I don't want to say, no, don't do it, or yes, that's fine, you can certainly do it. I guess you never know. Every year is different. But if history is any indication, at least at Case Western, it does get pretty tough. So I think that might be a school by school basis. Should I submit the secondary application later?
What if schools don't provide you with feedback? How do you know what to fix? And how should you approach a school that you weren't admitted to ask for feedback?
I think emailing the school is appropriate. Talk about your desire to improve, talk about your desire to attend that particular school, desire to be a part of their healthcare community. I think that's a good way to approach. I think I also maybe would advise you reach out once the application cycle is concluded. I maybe wouldn't reach out like August, September, when you're still waiting on, 15 other schools. I'd probably wait until maybe springtime, once we have a little bit more clarity on what my circumstances, the applicant, your circumstances might look like. I think if you aren't maybe having a lot of luck hearing from admissions professionals, I think that's when you go over to the pre-health side and kind of just exhaust those connections. Obviously, your pre-health advising office, I would think they might have a good idea of many things admissions professionals are looking like. There's a lot of collaboration opportunities. That's how, Brittany and myself have met. So they're going to have access to, I think, a lot of good, valuable information too to share with you if you can't directly hear it from an admissions professional.
Yeah, I wholeheartedly echo, if you can't talk to admissions folks, doing some deep debriefing. I mean, these slides will be available, this recording, like going back and going through step by step of what we just talked about. What do you see that might be a challenge or a problem that you could correct? Talking with your pre-health advisor is always going to be a good idea. Somebody who partners, who understands both sides of that. And in the case that you don't have that, our National Association, NAP, does have volunteer pre-health advisors you can reach out to. But most undergraduate institutions have a pre-health advisor. And even if you haven't been working with them, reaching out potentially and seeing if you can get some insight is always a good idea.
Fantastic plug for NAP. Thanks for that, Brittany. How do medical schools look at community college credits? Will I be at a disadvantage if I took my first couple of years at a community college?
We do accept community college coursework at Case Western on a case-by-case basis. That's going to be very much a school-by-school thing. I think we don't have a large number of prerequisites at Case Western. We just require 3 semesters of chemistry with lab. 2 of those semesters can be fulfilled via AP credit, general chemistry, and then 1 semester of biochemistry. So we don't have a ton of course requirements. I tend to be more accepting of community college credits, at least for the first 2 years, as long as your main core science courses are taken at a 4-year institution. I understand there's a level of reality with costs and whatnot, and that's something I like to think schools are mindful of, but I do think a lot of the core science coursework, such as your chemistry, such as your physics, such as your biology, you'll probably want to be taken at a 4-year institution. But the other credits, if it is with your circumstances more feasible at a community college, I like to think that would be acceptable. We tend to be pretty flexible with that at Case Western, but I guess it would be a school by school decision, so to speak. But I would like to think schools are a little more flexible in that front, just making sure those core science classes are at a 4-year institution.
I second the school by school. I think from a broad national view, from what I see on my side, I think a lot of medical schools indicate if you started at a community college and then matriculated to a 4-year institution, it is likely those courses are going to be fine. It's usually where if you started a 4-year institution that they may not accept the community college credit after you've matriculated to a 4-year institution. The WAMC also has a lovely handy chart for who accepts what types of credits. So you can take a look there too to give some guidance. And if you have questions, you can ask the admissions office at that institution or your pre-health advisor.
For our applicants who are coming from disadvantaged backgrounds, how do you tell their story, or how would you advise they tell their story without overly emphasizing the disadvantages?
This is my like sweet spot. Do I have a soapbox to get on? Because I think in talking to people like Tom and other people in admissions, I know how much they value understanding that story. And so when I work with students who have things that they want to talk about like that, I think what I encourage them to think about is, one, we're going to use that other impactful experience. section. You get 1350 extra characters on your primary. Let's use those. Your personal statement can be another place where you can explain how your disadvantaged person growing up, if that's how you view it, how that shaped you. What lenses did that give you? How did it set up for you a certain population of patients you want to serve down the line? Did it help you grow certain core competencies? A lot of my students will talk about resilience and adaptability from their childhood, and then into your secondaries. And so it's not necessarily about this is what happened to me, but this is how it shaped me, that I think is really important. And where I see students, one, feel the best about how they're communicating that. And for me as an advisor, that's my most important thing, is I want the advisees I'm working with to feel like they're telling their story in a way that they have agency and control over, and that they're comfortable with. And when they do that and they talk about how it's created strengths for them, how it has helped shape their goals, that's where they feel the best. And it's often when I see people like Tom pick up the phone more to offer some interviews. But I'm curious, Tom, what you see on your side.
Yeah, I guess this is dependent on a number of factors, Brittany. I think you my audio slightly cut out there, so I didn't quite hear everything you said. My apologies, but from what I heard, I think you hit a lot of really, really good points.
Are you still with us, Tom, or did your audio go?
Yeah, I
Okay,
cut out a
there
little
you
bit there.
go.
Sorry about that. Thank you about that. Sorry about that.
All right. If I started applying this cycle, but realized that I was lacking significant experience before I could begin medical school, would withdrawing my application negatively impact my chances in the future?
I can start. First of all, I just want to sort of like commend someone who did that work. Like as an advisor, if I heard that from a student or an advisee, like, hey, I really thought about this and maybe I'm not ready, I think that's a huge strength. I think that's some really awesome self-assessment skills that is very unlikely to hurt you. I think it depends when you withdrew that application, right? So details matter in this case. If you got to a point where you're going to be a reapplicant to schools that you applied to, they might not have seen your full application. They might not know why you're a reapplicant if they didn't see your full application, and maybe Tom can speak to that in a minute. But I think for students who sort of pull out of the cycle early because they realize they're not ready, and you've grown and you've been sure about it, like I encourage my students to think about like, what self-assessment skills did you grow through that process? And maybe we're not bluntly telling schools, hey, by the way, I started this and changed my mind, but maybe you are saying that last year I spent some time really thinking about what I needed to be ready to go to medical school, and this is what I learned from doing that reflection. I think that's where it can be a huge asset in somebody's application.
Yeah, I'll echo what Brittany said. I don't think that would impact your application in a negative way. I guess I wouldn't really have any more to comment on that. I think that's a personal decision, and I think you're recognizing, you know, where you are at in the process of applying, and kind of recognizing your circumstances with that. And I think knowing yourself well, kind of a lot of things we've already talked about. So I would say that would not impact your application in a negative way.
Fantastic. So I have one last question to pose to you guys, and then we'll get into some final closing and housekeeping reminders. If you could share one piece of advice, one final piece, what do you think is critical to let anybody who is reapplying know?
I would share that it's not a negative reflection on your application. I know that maybe there's a stigma out there, or a level of reality that people think, oh no, I'm at a disadvantage by reapplying. And I don't think that's true. I think that, yeah, applicants will see that you are, or excuse me, admissions offices will see that applicants are reapplying. But I think if you do all of these things that we've talked about, you can put yourself in a very favorable position and secure an acceptance still. I've seen many reapps go through the cycle of Case Western, and I'm sure you have seen it on your side of the aisle too, Brittany, that have done very well after a second application or after multiple attempts at applying. So I guess that's one thing I would say is believe you can do it. Don't let that discourage you. I know easier said than done, but you can still put yourself in that favorable position as long as as long as you're making changes, right? What's different since the last time you applied, and many of the things that we've discussed on this call today.
Yeah, I would echo that you can do this, you can keep going. I sometimes remind my advisees, like, what do they call you if you have to reapply at the end of medical school? They're still going to call you doctor. Have you ever asked your doctor how many times they had to apply to medical school, or what their MCAT score, or what their GPA was? And, some of my students laugh. I'm like, yeah, I did. I'm like, you're right, because you're pre-med, but most people don't. Maybe Tom and I ask our physicians those questions because of what we do, but most patients have no idea. Being ready for medicine and medical school as a person and as a student is the most important thing. And it doesn't matter what your path looks like to get there. As long as you're growing and changing and ready for when they admit you, that's the most important thing. So you're going to be a doctor at the end of it either way. We know your path might look different, but hang in there, because there's also a lot of beautiful things that people learn about themselves when they reapply that make them better doctors on the other side, in my opinion.
That's right. And thank you so much, you guys, for answering these questions. Thank you on the other side for your time and thoughtful questions. Before we wrap up, the recording of this session will be available in 24 hours within the Virtual Fair platform. It will be available for 30 days on the platform, then on YouTube, and the slides will also be available for you. Please join us for our next presentation at 12:15 p.m. Eastern Time on strategies to reduce anxiety for standardized exams like the MCAT. And don't forget, you can log in again tomorrow from 11 a.m. to 7 p.m. Eastern Time to connect with representatives from over 100 medical schools and post-bac programs. That includes Duke, that includes Case Western. The
We'll be there.
AAMC will also have colleagues at the virtual booth to answer any additional questions. Thank you guys again, and we hope to see you at the next session. Have a great day.
Thanks, everybody.
Thank you.